So last week we busted the myth of whether or not glasses made your eyes worse. Well, today we're going to tackle the other side of that coin on whether glasses make the eyes feel better or make the eyes improve. And so those are two opposite extremes, right? And reality is it's in the middle. Glasses don't make your eyes worse, they don't make your eyes better, but there's a big caveat on that. And the caveat on that is, what is our definition of better? Okay? So if you tell me that you're a -1 prescription and you're going to wear your glasses and your eyes are going to get better, the prescription is going to go from -1 to -50 to 0. Glasses aren't going to do that. And I've done a video talking about how glasses work, so I'm not going to go into the nuances of that. But for the most part, the way that this myth showed up is from people that were farsighted. So the reason we're farsighted is the eye's a little bit too short. So as we get taller, the eye gets a little bit longer. And so naturally, someone that's farsighted is going to have some growth spurts and probably work their way out of glasses naturally. And so that's how that myth got started, because some patients came in, they were a +1, +2, their eye was a little bit too short. We put them in glasses, they see a whole lot better. Next year they come in, their prescription is a little bit less. They hit some growth spurts, their eye got a little bit longer. So they think, wow, my eyes are improving, I'm wearing my glasses all the time. This is making it to where I don't need glasses anymore. And so that aspect of it is the giant myth that I needed to bust, that I wanted to bust. And so glasses don't make your eyes get better from a prescription standpoint. Now, how do they make your eyes get better from a disease standpoint? Because that may be a different story. So let's say I have a patient that comes in that has a condition called amblyopia. And I've done a video talking about amblyopia if you want to check that one out. But if they have amblyopia, that means the brain's slightly ignoring an eye. It's ignoring the eye sometimes for a refractive reason, meaning they don't have a glasses prescription. So if they have a large prescription in one eye, not a whole lot in the other eye, then the brain's ignoring that eye that has the large prescription when we don't wear our glasses. So then we put glasses on that person, and maybe they go from 20/40 is the best they could see with those glasses to the brain using that eye, and now they come back a year later and they're 20/30. So the glasses made their eye better, but they still have to wear that prescription. And so it improved their clarity, but it didn't reduce or remove their need for the glasses. And so that's another way that that myth gets started, because here I am telling you, glasses won't make your eyes better. But the next patient that walks in to see me, if they have amblyopia, I'm going to look at them and I'm going to tell them, wear your glasses and your eye's going to get better. But if I don't add that caveat and say, what I mean by better is you'll see clearer out of it, but still need to wear your glasses, I don't know how that patient interpreted that, right? I don't know if they interpreted better as meaning they're not going to need the glasses in the future. I don't know how they interpreted that aspect of it. And so that's where eye doctors or doctors in general will say one thing, but maybe got translated differently. Or maybe that scenario only applies in one situation. And so I have had days that I felt bipolar. I would literally tell one patient, no, wearing your glasses isn't going to make anything better. And then I go into the next patient, I'm like, yeah, wearing your glasses is going to make things better. We're not all the same cookie, and that's where medicine gets kind of muddy. Because if I give one standard advice for everybody out there, it's probably not going to apply to a lot of people. We're all a little bit different medically. If there's a video topic you want me to talk about, by all means, please leave it in the comments.